drugs and alcohol, which is not a pretty thing. We need to be kind. We need to be well. We need to make our relationships strong. I think this program will help us by coming together to return the needles in order for us to build relationships, not specifically identified as a person, but maybe in them building a relationship with somebody that they can get help or that will lead them into recovery. We need to help our people in this way. The other thing that I wanted to speak about was the disease factor. The cells in these needles are contaminated for as long as 36 days. We don't want our kids taking up these needles off the street. So if your child is in a park or someplace and they pick up a needle and they prick themselves, your wife, your son, your daughter, your family member, they can be contaminated by one of these very serious diseases. And I don't want that to happen to any of my family. And the diabetics that are involved in this program can bring their needles. A lot of these people do not have the resources to be able to buy their diabetic needles. And they can come here and get their needles and return their old needles. So I think that's a plus, and I think we need to do that for people who cannot afford to get the needles for their diabetes. Be well, be kind.
Thank you.
Richard Kiley.
I'm Dr. Richard Kiley. I'm the Executive Director of the Appalachian Community Health Center. I'm a licensed psychologist, and I'm somebody who gives a darn about what's going on in our communities. We serve Randolph, Barber, Upshur County, and work throughout the state. We're in a situation right now that is almost endemic. We're dealing with drugs that cannot be controlled, and we're dealing with people who are dying. The reality of our situation is this. Would you rather have a person have a needle exchange or die of HIV, Hep C, Hep A, Hep B? We go through that litany of those different types of things that people can contract. It is not a sin to be addicted. It is a problem that needs to be addressed. It is something that if we look back in history, it should be one of those situations where we're here to help each other, and we're to help each other in any way we possibly can. The Appalachian Community Health Center has been in existence since 1966, providing services. That's 52 years of dealing with people going through different things. We've seen the alcoholic epidemic. We've seen epidemics like AIDS going through in the 1980s. Don't touch them. Don't be near them. Don't do this. We're in a very similar situation with individuals and with needle exchange type of program. This program has the opportunity to help individuals who may not be able to help themselves. The description that we used on there and the types of things that we've been asked about are the types of things that, yes, we can make a difference, but we can't make a difference by being divided. There was a thing that was said once, and I want you to remember this. You are smart, you are kind, you are smart, you are important. That comes from the help. If you take a look at that a little further, we are kind, we are smart, we are important, and we want to treat all those we come in contact with the same kind of dignity and respect. The center stands and will stand for making sure anything that can help a person recover is possible. Anything. We need to offer hope, not fear. We need to offer opportunity, not deny opportunities and access. It's a difficult situation to be in. 1 minute?
No, you're done.
I'm done?
2 minutes, sorry.
Okay. Thank you.
Joy Messenger.
I'm going to need the.
Dr. Reed, I would defer to Dr. Kiley to continue on behalf of Appalachian Community Health Center.
We'll give you a chance at the end.
Yeah.
Richard Fogel.
That's not the deal. It's 2 minutes a person.
And they keep calling
it
My name is Richard
votes.
No.
I didn't get Hep C, just to have Hep C. I got Hep C from using dirty needles because I could not get cleaning. Now I'm in a position, in a medical situation where I can no longer work. I worked for the state of West Virginia, worked in the field of addiction. I also worked in the healthcare field. Because of that, I need a liver transplant because I have a disease. It's called Hep C. It's caused contracted by using dirty needles. And if I had clean needles, I wouldn't have Hep C standing here today. And I'm also, you want to cut down on that health bill cost, then I'm all for the needle exchange because there's a lot of other diseases that comes along with the Hep C and using dirty needles as an IV user because you can get Hep C, HIV, and other diseases that come along with it. And also, I like, he saved lives. And I think more people who does have Hep C need to be more educated on it, not spreading it otherwise. And I think it would save a lot of lives if the needle exchange would. And I promote it when I'm saying. Thank you.
Thank you, Turner.
Matt Kerner, I'm the Executive Director of Opportunity House Incorporated. I'm also the Substance Abuse Prevention Lead for Upshur County. There's a quote that keeps going, limited time, skip that. We'll get right to the point, and that is that I would like to encourage the board to stay the course and continue the implementation of the current harm reduction program. It takes great courage to do what is right in the face of what has gone beyond vocal opposition into what can easily be seen as open hostility by people who have rejected science in the form of hundreds of peer-reviewed studies done over decades in favor of feelings, fear, and uninformed opinions. We've seen respected members of the clergy weaponize their congregations against my brothers and sisters in the addicted community, and have had city council members go on radio programs and blatantly lie, claiming that programs like this would increase HIV and hepatitis cases, follow that up by claiming there was no evidence supporting the efficacy of harm reduction programs, and then accuse the highly regarded free clinic with 501c3 nonprofit status of running an illegal Ponzi scheme. He claimed the health right is suppressing evidence that these programs are counterproductive, a claim that he cannot have evidence for because it does not exist. I commend you all for standing up for what science has demonstrated is best for this and every community in the face of the personal attacks that you have had to contend with. What I see happening here with harm reduction is the same thing that I remember seeing at the beginning of the AIDS epidemic. The publicly expressed opinions of many was that HIV positive people shouldn't be treated because they got what they deserved for having gay sex or sharing needles. There was so much fear about where those people would be housed that to this day, hospital programs, housing opportunities for people with AIDS, still have different reporting standards than other HUD programs because those people need to be protected from hate and prejudice. The net result.
For 2 minutes.
Sorry, we don't have time for everybody to say everything they want to say.
Thank God.
Earl Smith.
My name is Burl Smith. I'm representing Burl Smith here this evening. I do not represent a group. In the interest of time, I want to give you my conclusion first. I think that it would be a good idea for this board to reassess this harm reduction program. We did not have public input We had maybe some input from the law enforcement, or maybe some county officials or city officials, but we did not have public input until after it was implemented. So my conclusion is to stop this program at this point in time. My understanding is that the grant was given to the Milan people out of Morgantown, and they work with several different county health departments. And the Upshur County Health, it's a Upshur County Health Department, has the opportunity of rescinding the decision that they have made. I do not see the effectiveness of this program, and so I would encourage you to do that. I've looked on the webpage for the West Virginia DHHR, and it gives a lot of information, guidelines for implementing this program. And one of the items they point out particularly was that in order to implement it, it had to determine the need for it. And then the way to get the community support was to initially go to the police group, then the elected officials, and then go to the general public. And I think the last point, going to the general public, was neglected. So once again, I encourage you to do this. I want to state that my dealings with the drug issue is not with my generation, but the generation immediately below me and the one following are really suffering at this point in time. The harm reduction program, I feel, is putting a square peg in a round hole. It's just trying to make it fit when it really doesn't. Thank you.
Dean?
We got a lot of time
I
over
will
here.
defer my time to Susan Foster.
Okay.
No. She's got us a lock on.
So I would like to share with you some information that I got from the Charleston Health Right program, which also offers a harm reduction program. And I'd like to know why their program was not considered as a model for how to implement a program like that in this county. Some of the things that I learned from speaking with the executive director of that program is they only issue 30 needles at a time, and all 30 needles must be returned before they will be given any more needles. They must provide a photo ID or two other forms of identification, such as a social security card, voter registration card, etc. They will serve people from outside Kanawha County, provided that they have established Charleston Health Right as their medical home and receive other services there. So they can't just show up just to get needles. They are a strict 1-to-1 exchange program. If 29 needles are returned out of the 30, then they have to account for what happened to that one needle, and they have to have a pretty darn good reason why they didn't return that needle. If they don't, then they're subject to being penalized. The director told me that she gives them 3 chances. The first time they are put on probation, they decrease the number of needles they provide. The second time, they are further decreased. The third time, they're out. So they do require accountability, from the participants, not just giving them needles without any expectation or any way of monitoring what's returned. They will provide cookers if they're requested, but they do not just routinely provide those or advertise that those are available. They do expect that the participants be tested for HIV, Hep B, and Hep C. It cannot be required, by law, but it is strongly encouraged. They are required to see a provider and a therapist at every visit. I have my 2 minutes also. Okay. I'll resume when it's my turn again.
Bravo. See how they did that. Yep. To him side.
Anthony? I mispronounced your name, I'm sorry. Please tell us how it's said.
Hello, my name is Angela Mahaffey. I'm an RN, and I work at West Virginia Wesleyan College. I have been a nurse for over 20 years, and half of that time has been spent in ERs. They've been in ERs in places like Kansas City, and also small rural areas like up in Elkins. If you think that the drug issues, or there aren't very many people using needles around here, it's less because we're a small rural area, I have to tell you, it's just much more hidden. As a nurse taking care of patients, kissing the foreheads of people who are dying because they waited to come in because they were afraid of how they'd be treated by our own community, by nurses and doctors. They died. I mean, these people died. Where if they would have came when they first realized that they were sick, we might have been able to do something to help them. I just want to say that what we are trying to do, what Upshur County is trying to do, we're trying to just help put things into practice to help prevent long-term poor outcomes. And we can't do that if we're not looking at best practices. And that's what healthcare providers, that's what we do. We look at best practices, we look at research, and that is how we decide what needs to be done and what is best on how we do those things. And so this is a program that has been around. This is not new, it's just new to this area. And we need to do these things. We need to help protect our children. We need to teach health and safety to our people, to our patients, to anybody that uses drugs, but not just uses, okay. Thank you.
Lindsay, Chris?
Hello, my name is Dr. Lindsay Kress. I'm a family physician here in town. And as a doctor, I go by science, so I'm here for some science. So in 2007, West Virginia was reported as having the highest incidence of acute hepatitis B, and either ranked first or second in acute hepatitis C in the United States. In 2015 and 16, the incidence rate was 4.8 and 5.7 times greater than the national average for hepatitis C. The CDC actually did a study in Scott County, Indiana, which is relatively comparable to Upshur County. It's a rural county, a population of about 24,000 people. Prior to 2014, there were about less than 5 cases of HIV in the entire county. In 2014 and 2015, 181 people were infected with HIV. It was determined that this was due to IV drug use. So they looked at other counties that might be vulnerable in the United States and looked at over 2,000 counties. Of those 2,000, there were about 200 or just over 200 that were seen as vulnerable. Of those, 28 were in West Virginia. 28 of 55 of our counties were vulnerable for a major HIV outbreak because of IV drug use. These harm reduction programs aim to prevent that, and in addition to that, they are also acting as an access point for these patients to come and be counseled and be supported and allow the opportunity to go into rehab should they choose. People that do these programs are 5 times more likely to enter into a rehab program than if they had not. They're also a third less likely to share needles if they have clean needles and education that tells them how to perform these clean injection practices. So, thank you.
Amy Kale?
Good evening. I'm Amy Kale, and I'm just here as an individual. I will be reading my information just because I like to stick to my 2 minutes. But I'm going to direct this to the board. I'm not opposed to providing support. However, I am opposed to enabling a negative behavior without accountability. And I feel that's what this program is doing if it's not a one-to-one exchange. Each day, as a teacher, I see numerous children bring items to school that they normally would have never had access to had it not been in their home. Each time one student brings an inappropriate item to school, that exposes an average of 3 additional students. If you hand out just 100 needles a month to one household, in a year that's 1,200 needles within that one home that's not accounted for. Chances are those needles are going to end up on the school bus, in the classroom, and more than likely those are going to be the dirty needles that are not accounted for. I ask that you require accountability if this program does continue. Require names, addresses, if there's children in the home. When we call as an educator to report an incident, the DHHR's first question is how many children and what are their ages? Why are we not asking that when we're handing out materials that's enabling a drug addiction with children in the home?
That's right.
If that one home has 3 children, and there's 3 children, take that.
Thank you.
Tracy Gould,
I'm going to defer my time to Charlotte Smith.
to who?
Charlotte Smith.
Sure. You'll remember, she was here.
Good evening, my name is Charlotte Smith, and I am the Service Unit Director of the Upshur County Salvation Army. Sometimes I think we're losing focus here. I feel like some people in this room feel like some of us are completely opposed to this program. We are not opposed to this program. We simply want guidelines. That's it.
Amen.
Amen.
Right. There you go. That's right.
I was at the safety complex meeting. From what I understand, the contract was proposed in January. It was signed off in March, and it was put in full operation in April. Nobody in the public, nobody in the community, nobody was asked, can you come join us and help you make this program work? Can you help us in setting some guidelines? What are your opinions about guidelines? What are some ideas you have as a community to make this program work? Me, as a mother of a drug addict, not heroin, not an IV drug user, however, a drug addict, I have minors in my home. Who in their right mind would think that a minor can go to a van and leave with everything they need to be a heroin addict, other than the drug? Me, myself, if I would find my minor going to a van and doing that, I would feel that there could be legal action taken because you're contributing to a minor.
Amen.
People call this the needle exchange program. This is not an exchange program, and Mrs. Sussman made that clear at the safety complex meeting. There is not a requirement to turn the needles in that are given. If you're given 100 needles, you can come back the following month, you can pick up 100 needles, not turning in any needles. That's not an exchange program. That is not. That is, here I give this to you, leave your needles wherever, come back, and in 30 days we'll give you more needles. I'm going to use the words of Doug Spears, and he is with Solar Recovery. You cannot take an irrational person and make them rational, and you cannot take an irresponsible person and expect them to be responsible. They do not mandate counseling. It is not a requirement. They offer it, but it's not a requirement. Why can we not set a guideline? Okay, I'll finish whenever time's given to me.
Thank you.
Thanks.
Ben Rice,
I'm going to turn my time back to
At the end. At the end. That's not fair. That's not fair. That's not fair. Well, then she should have 4 minutes at the end, correct? Okay. Make sure you keep track of that. Go shorter at the end. He's key.
That's me.
There you.
Yep.
There, that's her name. Oh, you're bumped to the end again.
Two slots at the end. That'd be hard.
Hi, I'm Debbie Carpenter. I'm Director of Nursing for Community Care of West Virginia. I've been a nurse for a long time. I should say long. But I did want to speak to the patients that, that I see. We see so many patients that are young, that are in their early 20s, late teens. These kids are coming in, they have hepatitis C already. And, we really need to think about what we are doing to protect our patients. I know that there are, discrepancies and problems and people don't all agree. But the bottom line is, if we can save one life by doing this needle exchange, then I think it's a successful program. Do I think we need guidelines? Yes, I do. And I don't see anything wrong with asking for an exchange for those needles, because I think that I've heard that from different community members as well, that they're worried about what's happening with those dirty needles. But I think we can also educate those patients or those people that are coming in about how to dispose of them. And so I think that goes along with, not only are they getting offering for counseling, but they're also getting education regarding proper disposal and so on and so on. So, really, we really just have to think about the people whose lives we can save.
Yeah.
Heather Snyder.
Hi, my name is Heather Schneider. Thanks again for doing this meeting. Here as a community member, I think the most important thing to remember about this program is that it's about harm reduction. And I'm also not opposed to the community really delving into the isolation that is often what creates addiction, and trying to figure out what this program would look like in Buchanan, because every community is different. But I do think this program needs to continue, because the harm reduction program does reduce the spread of disease and infection. There's studies out there saying that. And it does reduce the isolation of people struggling with addiction. I think more than anything, them getting into contact with a healthy individual is what's really going to help them create at least one healthy relationship, while their life might be spiraling out of control and they are getting deeper and deeper into whatever addiction that they're struggling with. I also want to say that the entire world is my family, and I know that might sound kind of silly, but I think everybody in this room, and I recognize a lot of faces from the last meeting, does feel that way in their heart. And so I don't want any person to die because we did not give them a clean needle, and they were in a place where they were not in control. Matt spoke to it last time. They are not in, they're out of control. They need to get the next fix. And so if there's a dirty needle, that's what they're going to use. So I think we really need to listen to the science, listen to, thank you.
She's right on.
What's that? 4 minutes.
Two. She has two more. Yeah. Well,
Okay, so I'll talk real fast and finish up what I was gonna say. I also talked.
The mic's not on. Mic's not on.
The one up on top.
We'll start over.
So, I also talked to Marion County and Harrison County to see how they run their programs, and they are not affiliated with the Project Light program, so they do things a bit differently. Again, more accountability. Harrison County will only issue 40 needles at a time, and they must return all of those. If they do not, they will only issue them 10. They are getting some pushback and some opposition from local businesses. They do have police presence there at the clinic when they are at the health department when they issue when they do their needle exchange. Marion County limits it also to 40 per visit, maximum of 160 per month, so basically 40 per week. They have to return all of those needles before any additional needles are provided. Which again, what's wrong with accountability? You know, we're not asking to not give needles out at all. In an ideal world, yes, but this isn't an ideal world. We're asking simply for some accountability.
Yeah.
So in a nutshell, I would just say that we're asking that this program be revisited and some more stringent guidelines put in place similar to what is being provided by the Charleston Health Right Program and Marion County and Harrison County. We can learn from what they're doing. The Charleston Health Right Program has been in existence since 2011. We don't need to reinvent the wheel. We just need to take it and to modify it to meet the needs of our community. I would ask for things such as possibly considering doing retractable needles. Charleston Health Right is studying that right now. They're using retractable needles. They've been doing that since March, so they don't really have a lot of data yet to report about that. But they're doing this out of a willingness because they had opposition from their community, and they listened to what the community's concerns were, and they're willing to work with the community to try to resolve these issues. I would encourage you all to do the same.
She's got 4 minutes. And she'll get through a lot in 4 minutes. Ready?
Okay, I'm not quite sure where I left off, but anyway. At the Salvation Army, I one-on-one deal with numerous people that come into my office, and they, however, are drug addicts, and they are heroin addicts. Upon speaking to some of them, sometimes if you sit down and you do speak to them and you take a moment of your time, which I do, and they'll actually open up and be, frankly, quite honest in their input on this program. I've been told that it's a heaven sent to be able to get needles to feed my drug addiction with no more worries of where my needles are going to be. If I want to get clean, I'll get clean. I don't need someone to tell me to get clean, but I'm just glad that the needles are going to be given to me. I guess if I get hard up for my heroin, I can sell my narcan, which was being given to them as well. A lot of people in this community were blindsided. We went in there with the needle exchange program, and we were blindsided with tourniquets, burners, Narcan, alcohol. One of the slides stated safe injection. They were going to teach them to safely inject, and that's on a slide. I have that. So once again, this county isn't opposed to this program. It's simply like suspend it, bring the community on board. Let us have some input in it, care about our opinions, our thoughts, because we understand that there's an epidemic in this county. We're not dumb to that. A lot of us have suffered that. We understand there's Hep C, we understand there's HIV, but also, I'm hearing all these statistics, but everybody's getting their statistics from a website or so forth. Has anybody been to St. Joe's? Has anybody been able to say this is the statistics for Upshur County? Because I haven't heard that. I haven't heard someone to just say this is how many we've seen in Upshur County in the last year. So that's a question I have. I just feel like another thing I want to share is we have concerns because if you're just giving someone needles with no exchange required, heroin addicts have the highest relapse rate. I know that. They have the highest relapse rate across the United States. I just feel that if he's saying here we're going to send you to rehab, but you're going to come out and this van's going to be here, but all the needles are still going to be there. Accountability is a big thing. We're all held accountable for so many things in our lives, and there's no accountability with this program. And I think the community is just really upset because we weren't brought on board. This was just a decision made, and we were, here you go, and you have to deal with it. So now you've got all these people out here researching, who do you answer to? Who's above your board? Because obviously it's not the Upshur County Commission. permission. So who do you all answer to? Who oversees your decisions? Because the community obviously doesn't. And that's what has so many in this community in an uproar, because we just kind of get pushed into the rug. Here's your program, you all deal with it, this is what we're going to do. And it's come to this point for us to get our plan across. And I just don't think it should have to come to that at all. We pay tax dollars, and we're this means a lot to us too. We care. Like I said, people in this room, you think that we're dead set against it, we're not. We just simply want guidelines, we don't know what those guidelines are going to be, and we just want to be part of the decision making. Thank you.
But I am totally opposed to the way this process, or lack of process, was handled. The contract was signed in March. I'm on city council. I'm not speaking as a city council person, but I'm speaking as Dave Thomas. I think the program should be reassessed, reevaluated, involve the community.
Yep.
Right now, there's no trust.
Amen.
And I want to help people. I have a lot of respect for everybody that talked here this evening, but involve us. That's very important. You don't want to have negativity immediately, and that's what you have. So please reassess it, reevaluate it, have a good program, but let's use people working together. Thank you.
Addiction is oftentimes described as a disease of denial, a disease of shame, a disease that people are afraid to do something with, and sometimes you have to do something under the covers to get it over the top, to get the people served. Rather than belaboring points, there's lies, darn lies, and statistics. We can all hear different things and report in different ways. But the reality is this. The remaining portion of my time here, I want you to sit in silence for a moment. For those people we were not able to serve because we did not know better. A moment of silence for those who we could serve, that if we don't do this, we'll die. We have members of our community who have died. Let's keep that from happening anymore. A reasonable program that can be implemented now and modified as it needs to go along is what probably needs to happen. At this point in time, let's be silent for those who have and those who will die. Harm reduction can and will work. Thank you.
Since I'm last, I get more. I want to throw out some numbers too. 32, that's how many people last year died of HIV in the state of West Virginia, 32. 909 died of overdose drugs in West Virginia last year. Now, where's the harm that's being reduced? I don't know of anybody that died of HIV. Now, I'm sorry, hepatitis C last year. Could not find that statistic, but I'm sure that they're out there. But Richard, you're alive, but that 909, they don't have a chance to get better because they're dead. And so to give them a needle to be able to continue on with their habit without some counseling, without some help, it's just not, it's not right. And again, over and over again, people have said, we're not here to stop it. My note says we need a task force to look into this. The idea of harm reduction is important, but when it has no safeguards, it gets out of place. We want safeguards to be able to take care of this problem. I am a father, a parent of an IV drug user that I have in a program right now getting help, so I know personally how hard it is. I asked him, son, up in Morgantown, are you a part of that? He said, yes. I said, well, do you use the needles? He says, yes. Do you return them? He says, no. Why don't you return them? Reason, because the needles are everywhere. We don't have to. We use them. We throw them down. And also work over at the Bob Mays Recovery Center, HIV programs. Bob Mays Recovery Program, kids 18-24, struggling with addiction programs. They're every Wednesday. Been there for 5 years. I asked them this week, what do you think? Boy from Grafton says, I used the whole day going to Morgantown, Marion County, Clarksburg to get needles. Another boy said, I never got the needles for myself. I sent somebody because I was afraid the police were going to be watching. I'm on probation. I get a list of my friends to be able to get the needles for everybody else. Lewis County had a girl over there that said, my daughter picked up one. So we just want guidelines.
Yeah, that's right.
Yes,
yep.
yes.
I'm asking you to come back and finish your presentation.
That's that's he stacked the deck on that. That is
Alright. Time this, please.
At the end of the AIDS reference. So I know the paragraph. People in the addicted population and those that love us have become conditioned to being dehumanized, marginalized, and degraded. We're used to having no voice because political and community leaders are afraid to stand up for us because we have a disease that many of their constituents believe we chose to have, and then we're not sick, we're morally deficient. Because of that, resources for prevention, intervention, treatment, and recovery are scarce. When we see a program come along that can prevent others from laying down the same dark path that many of us have, to us it is a rare point of light. It is imperative that the Board of Health stand your ground and not allow the darkness of intolerance, the darkness of prejudice, and the darkness of fear extinguish that light.
I would like to say I never heard one person say that anybody was that. Nobody.
Yeah. No, we know.
Nobody was that.
No.
Hey,
You give him extra time.
can he have extra time to complete his presentation, please?
We gave him extra time. How about Pastor Ed?
He wasn't finished.
Absolutely.
Matt wasn't finished. Matt was given the chance to finish. I would like Mr.
Yeah.
There you go.
Nobody is that way here. That's the thing, Doc. You've got to
Attention, please. And finish.
Thank you.
Thank you.
Thank you.
Much appreciated.
Thank you.
I would just like to say we are citizens of Upshur County, okay? Citizens. That's all we are right here, wanting the best for everyone here. I bet you every one of us, board included, have got somebody that you have that's in this world of hurt. And all we want to do is to be able to stop that hurt from coming. We don't think needle giveaway is it. You come in and say you get 150 needles, you come back and you only bring 50, you get another 150 needles. That's just wrong.
Yes.
We're going to end up having to pick them up. Everyone who's ever started the program has looked at the needle exchange, and I've heard nothing but needle exchange. Most all of you spoke about needle exchange, but Charlene, you're right, it's not, it's needle giveaway.
Yes.
We want it to be a needle exchange, and that nobody is trying to stop. Nobody's looking bad at anyone.
That's right.
Especially when every one of us probably got somebody that's very close. I love my son. I'll fight for my son.
Amen.
My wife and I have invested a lot of money to try to get my son where he needs to be. But I'm telling you, I would never give him a needle and say, son, go out the door and use the needle safely.
Amen.
Amen.
Thank you. Thank you.
We have a program.
That's right.
It's not harm reduction to me. It should be called needle exchange. Sue, you said that to the county commission when you introduced to them. You said you give them 50 needles, they come back, and I've got it quoted out of the paper. They bring back 25, they get 25. You were asked that when I went to the meeting, and you said, I made a mistake. Sue, that's a big mistake. It's needle exchange that we're looking for to be able to have some accountability so that we don't have to get a citizen group to go out and teach you how to pick up dirty needles, because that's what I'm afraid is going to happen. So please, we don't want to be divided. I don't feel divided. I am not that minister, whoever you're talking about, that set the people out here. This is not my group. These are my friends. These are my citizens. We are citizens of Upshur County and not a group of people that are a vigilante group. Thank you very much.
Exactly. Don't enable the problem.
Robin, Planning.
I'm not quite sure how to follow that, but I'm going to try. I am a person who for the past 20 years has been doing research and service provision for people who inject drugs. I've done it all over the country, and for the last year and a half I've been doing it in West Virginia. I have a PhD in infectious disease epidemiology, so I know a lot of the science that we talk about. I've generated some of that science. But I also meet people who inject drugs almost every day at work. And I work with needle exchanges all over the state of West Virginia now, or syringe services programs, as many of them are called. Someone at the beginning, one of the speakers said that we need to be kind, be smart, and be important, which I think really rings true for me and my experience in this area. We need to be kind because these programs are kind. They reach out to people who otherwise are cast to the side and are hidden. So one of the folks said that we don't have good statistics for Upshur County. One of the reasons is that folks won't come out and get tested for these diseases because they don't know where to go and they're afraid to come out and get tested, right? I have a little more time on it. The other reason that they're kind is they engage people in a positive way to start taking some responsibility for their health. So the thousands of people that I've seen that have come to these programs at programs all over the country, I rarely see people who come in and say, I'm here to get these syringes, and they come in and they're trying to take positive action to protect themselves. In my 20 years of doing this, I have never heard a person say, if I didn't have this syringe, I wouldn't inject drugs. What they tell me is, I will use that same syringe again. And every week I see people in the WVU hospital who are in their 20s who have had valve replacements and open heart surgery because they've been infected by reusing a syringe until it breaks open. They tell me they'll share with someone else. They tell me they'll pick it up out of a puddle because it's been discarded and use that syringe. So it's not people who are careless about their stuff, it's people that are taking positive steps and responsibility to try to do something good for themselves in the midst of their addiction. I also want to say that these programs are kind because they link people to treatment where it's available.
2 minutes.
We don't have a lot of treatment in this state. And so what we have is a lot of people who want to be treated, but can't get into a treatment program. At WVU, we have a program, it's a really well-known program, that has 550 treatment slots. We have 600 people on the waiting list. What do we have to offer those people while they're waiting for treatment? It's a program like this to keep them alive and keep them healthy. I know many people who have HIV because they couldn't get syringes. I don't want that to happen to somebody else. I think these programs are smart because we have 30 years of science that says that they prevent disease. They prevent HIV, they prevent the behaviors that transmit hepatitis C. They prevent overdoses by giving people information and then naloxone they need to keep themselves alive. They also save money if that's something that you care about. And the last thing is be important. People have, I won't belabor it, but there's a huge, huge need in this state for programs, whatever they are, that will help people who inject drugs. So we have the highest rates of overdose. For 10 years, we've had the highest rate of overdose in the entire country. We have the highest rates of hepatitis B and C, and we've just had an outbreak of HIV in the southern part of the county. You don't know if HIV is here because these folks are not coming in to get tested.
State, not the county.
Oh, sorry, the southern part of the state. But the other thing about being important is that for these programs to be important, they have to be effective. And I appreciate that a lot of you are talking about having guidelines for these programs that you feel comfortable with. The tension there is that some of these guidelines infringe on the effectiveness of the programs. Milan Health Right runs a model program, which means that they follow the WHO guidelines, they follow national guidelines, and all those guidelines are based on 30 years of really, really good science. They are a model program, they know what works, and anyone would be fortunate to have them in their county doing this work. So there are things that you can do that sound like the right thing to do. But if they make the program so ineffective that people won't, that people are not coming to it, they're not using it, then you're not gaining anything, right? You can have 5 people come to this, you want as many people to come to this as possible so that you don't have these diseases circulating in your community. Because the more
How are
disease
we
you have,
gaining
the more
by
likely it
throwing
is
that
to
many more
transmit
needles on the ground?
The last thing that I'll say is that I have been to these programs all over the country and in other countries too, right? It is very rare that you see a negative impact to the surrounding community from these programs. I know that doesn't sound intuitive, but it's true. There's often a lot of controversy about it, but you don't see the negative impacts. And we can talk about Charleston or whatever it is that you like, but I can tell you that that's the case. Hundreds of programs are operating in this country without negative impacts, but they're saving people's lives. And so I just hope that you'll think about these things. I'll be around, I'm happy to answer questions afterwards, but thank you very much for having me.
6 minutes.
And we're a little unclear about this. One number was 32, one was 21, is that right, Sue? And I'm not sure whether that's new or whether that's cumulative. The Upshur County EMS said they had used 85 doses of naloxone or narcan in the last year. Thank you all for coming, for your contributions. I'm very satisfied, very impressed that you are making your will, your thoughts known. It is up to the board to make decisions. And Rich Clemens has something he would like to add.
I'm sorry I didn't meet the schedule. I was in another meeting. But I want to talk to these folks. I want to talk to these folks. I know some of you, I know Dr. Reed. I appreciate what you're doing. It's not easy sitting on that side of the table. I've sat on that side of the table on many issues, not health concern, but I've sat on that side of the table many times, and it's not easy. I encourage you to not suspend this program. Keep it going. Don't turn your back on the people that need it the most right now. Maybe you need to form a committee. I mean, this is obvious stuff. Maybe you need to form a committee to help you come up with some guidelines, some suggestions on how to tweak it, but don't stop it. I got a son that needs this program. Everybody has an issue. I inject myself twice a day. Happens to be for diabetes, but my instructions say use a clean needle every time. And I could do that. A box of them is $9 at Walmart retail. It's no big deal. But to the people that need it, it's life. So don't step back. Stay with the program. Keep the program going. Maybe
If they're that cheap, why can these drug addicts not afford them?
That's what I just... We got a lot of folks that need on that. One of them got picked up last night because I listened to the scan. He needed it. We just need to think about the community and helping it. Sometimes it's tough decisions, but it's worth it. It really is. And I thank Dr. Reed for all you've done. You could be at home, relaxing, not be involved in this community. And you help this community every day. You continue to help this community every day. And I'm impressed with that. And besides, folks, one of the things it sounds like you might need is some dirty needle counters. Because you're going to need some dirty needle counters to figure out how many you're going to give out the next time. We've got a whole audience full of them right here. They're ready to count your dirty needles.
Sure will.
Yep. Absolutely.
Got it.
But go with the program. Keep the program. It's important. Thank you.
You gotta let us be a part of it, though.
That's all I got to say. Michael, it's your job.
Thank you, Dr. Reed. We will continue on with the rest of our agenda. Under consent agenda, you have the minutes of May 11th and June 4th.
And our sole purpose is to protect you and our families. That's what we did. Okay? We've made some tough decisions. We've had to in the past. I'm the old man on here. I've been here longer than any of the others. But we've had to make some really tough decisions. Not always all they're popular with everybody. Okay? But we do not have a deaf ear also. Okay? I want you to know that. You all here and here are citizens of this community. We are here because we love this community where we live. Okay? Just remember that. We're not the enemy. We're here.
Nor we.
We know that too. Sometimes it didn't come across as that, but that's fine.
That works both ways.
You're all entitled to opinions. We are too. Okay? But just knowing that we're here and we do not have a deaf ear. That's all I'm going to say.
Thank you very much. Appreciate it.
There you go.
I'm new. So thanks for getting me broken really good for the first time. And I agree with Larry. You know, people that we take care of in this community. So our goal is to try to help as many people who are harmed drug addiction as much as we can. Because trust me, we see it in the office, and we love these people like they're our families. And our job is to take care of people, be compassionate, and try to do what's right for the community. Thank you.
Thank you.
I agree with everything that Larry and Kessa have said. I love my community. I love the county that I live in. And I just want to do what is best for our county. I have grandchildren that live in this county, and I love them dearly.
Thanks. I have to agree with them. Just remember that we are all volunteers. We are not getting paid to do this job. It comes out of my husband's asked me to step down just because of the meetings and the meetings and the meetings that we have that were only supposed to be for a year. We have to make a lot of tough decisions over the last 2 years. We've had several meetings about several different things that we've had to do. Not all of them have been a lot of hard decisions. And I appreciate you all coming out and giving us more opinions. And I've taken notes, and we'll be discussing stuff later. Thank you.
All of you for coming out this evening. I agree with the sentiments of the rest of the board. We're charged with looking out the public well-being of the 24,000 residents in Upshur County. We do not take that very lightly. We make decisions in the best interest that we feel that will protect all citizens of this county, regardless of where they are at. I'm born and raised here. I love this place. I'm going to continue to make decisions, and this board that I feel are the best protect us for now and the future. And with that being said, again, I thank you all for coming out. And if you continue to have any other questions, you can always call our health department, 304-472-2810. As always, our Board of Health meetings are open to the public, and that'll be announced in the paper. The agenda will be out again 10 days beforehand, so if you would like to be put on the agenda for future, you need to call the health department 10 days before the scheduled Board of Health meeting. I thank you all for coming this evening, and I look forward to continued discussions for the future. With that being said, I will entertain a motion to adjourn. Is there a second? All those in favor, please signify so by saying aye. Yes. All right, we will, personnel issue? I would entertain a motion to go into executive session.
So it's yours.
Is there a second? Thank you. Thank you all for coming.